Hi, my name is Jessica Chastka, and I'm a physical therapist at Ladybird Physical Therapy. Okay, so you've been watching this videos, you've waited 12 weeks, and you're like, I am ready to go, and I want to run. But you know that you want to make sure you get back safely. This is where I'm going to talk about, like, in general, what should you be able to do to know that it's, like, probably okay to run. And I say generally and probably because truthfully the best way to know is to go see a pelvic floor physical therapist, get your pelvic floor, abdominals, like body holistic, like assessed to truly know what is right for you. But I realize that not everyone has that capability. And so if you are one of those people, then this is a video where it's like, these things you should be able to do before you go run. Okay, so what I would say first off is you don't have any symptoms. You don't have any like vaginal heaviness, vaginal or rectal heaviness, any urinary or fecal leakage of any kind. You don't have any pain, that kind of thing. And you're able to walk for 30 minutes without any issues. So you feel good, you feel strong when you're walking. Other things is like you want to have good balance. Okay, running is essentially an accelerated single limb stance. So if you feel like you still have sea legs, you should probably work on your balance for a little bit. You also want to make sure you have good glute, hip, rotator, and even hip flexor strength. All of those all those muscles you really use when you run. And so you want to feel strong, and that is like a way you'll be successful even with like performance and just like not injuring yourself. So you want to have good glute, hip rotator, hip flexor strength. The other things you want to be able to do is, truthfully, you should be able to like kind of like jog in place a little bit, or like you've accidentally maybe like ran after your toddler or ran after your dog, and you thought, okay, that wasn't too bad. And so a little jog, kind of test it out and see if that feels good. The other things you should be able to do are jump. You should be able to, jump in place. There's all kinds of jumping exercises, but if you do those and you feel good with them, you don't feel symptoms with anything, symptoms meaning leakage, heaviness, pain, then that is a sign that you were like most likely okay to start running or to see how that feels, okay? So to review, you've waited 12 weeks, you feel really good, you feel strong with walking, you have good balance, you have good glute, hip rotator, hip flexor strength. You can do a little short jog around, your living room, and you can do some jumping exercises without any issues, okay? So stay tuned for future videos where we talk more about returning to running postpartum.